Welcome back. You work out, you play hard, you get sore muscles, you want to ease that pain. And acupuncture has been around for thousands of years, but there's a new form of treatment at Avera Health that uses the same trigger point principle to relieve muscle pain. Here is Elaina Lanson.
So Jason, dry needling in South Dakota is somewhat of a new concept. There was a bill passed in 2018. You guys are now allowed to do it here. What are the basics of dry needling that people would like to know about?
Yeah, so basically dry needling is the use of a thin filiform needle that we use to penetrate the skin and stimulate the underlying trigger points, muscle, connective tissue for the greater purpose of healing and relieving pain, restoring function.
And what type of injuries would you look to maybe try dry needling on before you try something else?
So really it's a great tool. We can use it on both acute injuries as well as things that are more chronic in nature. With the acute injuries, we can use it to help decrease pain right off the get-go, and it helps increase the inflammatory response and get the healing properties there. But then as far as an acute injury goes, we can actually use it to reintroduce a healing response if the injury's been happening for a while and just kind of in a stagnant state. So we can use it for that as well. So really it's kind of a all-encompassing tool to be able to use.
And someone who might be looking to do this, how long can they expect the appointment to last? Someone who might not like needles, how many needles can they expect and for how long?
So I mean, there can be variability based on those sort of concerns by the patients, but typically we do a thorough evaluation first to make sure that we're not just poking needles into someone just to, help with their pain versus going after the total solution. But it can range from anywhere from just a couple depending on what area we're after, but as far as like neck pain, we can go as many as 8 to 10.
And what type of reaction are you looking for from the body? Does it depend on the certain type of injury? What actually is going on inside the body to help repair itself? Because there is no medication going in when you're doing dry needling, correct?
Yep, so when we put the needle in, the body recognizes a foreign stimulus. And so basically what we're doing with dry needling is we're trying to play the physiology game of the body to kind of manipulate it to our advantage. And so what happens with the trigger points, when we hit those, the muscle twitches and it causes a release of the contracted muscles. It causes a chemical reaction with those to cause it to release. So there's a lot of instantaneous kind of relaxation in that aspect of things. With the other areas that we would treat where we're not typically going to see that twitch, we can apply E-stim to get the muscles to twitch, kind of hit the bypass on it a little bit. And we could also just leave them without the stim as well.
And when you think needling, a lot of people think of acupuncture. What are the differences between the two?
Yep. So the biggest difference, the easiest way to sum it up, I tell patients all the time, is it's a Western medicine versus an Eastern medicine approach. So the tool might be a little bit similar, but really it's a neuroanatomy basis and physiology game on our side of it. More on the Eastern medicine, the traditional Chinese medicine, we're talking more of the qi, the meridians, tongues, just a different thought process. We're on the same team, it's all the same common goal, trying to get people to feel better, but it's a different thought process and philosophy.
Definitely another avenue to get better.
Absolutely.
Great hearing all of that information. Thank you so much for everything. And I mean, if you're battling it, check it out.
Yep, absolutely. It's really, I've had people that come in that are actually scared of needles and they come back the next time and they say, we got to do that again. So it's really interesting, and I know it's not just a placebo to see those people come back knowing that we got to do this again, kind of a deal. It's fun.
Thank you so much, Jason.
Absolutely.